All right, welcome to Duke Spine Institute. I'm Dr. Duke Majan. Our patient comes from Louisiana, has a large thoracic disc herniation at T6-T7. It's affecting both sides, the nerves, so we're going to treat both sides. The first thing we have to do is get the right disc, and that means we have to use the X-ray machine to find the disc, confirm it from the top to the bottom. It's going to take us a few minutes. We're going to place 2 needles, one on the left side, one on the right. T6-7 is right where his pain is, and that's what he wants us to fix. All right, so let's go up to T1. I think I see T1 there. T1, 2, 3, 4, 5, 6, 7. All right, so I'm at 7, 8, so I need to come up just a smidgen. Shot, right about there. That should be 6, 7. We're going to verify that. Let's go down low. Shot. Right now, shot. All right, let's go down a little bit lower. Shot. All right, there's 12, 11, 10, 9, 8, 7. So, I think we just got a little parallax going. Go north a little bit. Go north a little bit. Stop. Shot. 12, 11, 10, 9, 8, 7, 6. Alright. So, give me the... We used to have something that went across. Yeah. I don't like this. Shot. Alright. 12, 11, 10, 9, 8, 7. That's 7, 8. You agree? We want 6, 7. Shot. Shot. Now go to the top. Stop. Shot. See how the parallax has moved it? Go north. So 1, 2, 3, 4, 5, yeah, 6, 7. So it is right there. All right. It's where we put our mark. You have to always verify top to bottom, bottom to top when you're dealing with thoracic, because number one, patients may not have 12 ribs. They may have 13. But take that. I'm going to go ahead and place my needle and then verify position. The placement of the needle is different with thoracic than lumbar and cervical. It's a bit more complicated. Shot. I'm really having a hard time with this light right in my eyes. All right, I guess I could look up there. Let's go with a lateral view. If you have questions, feel free to ask them. Shot. My table's going to have to come up. Well, actually, that's not bad. All right, so the question is, where is 6, 7? I have a feeling that's 6, 7 there. So I can aim down a little, but I have a feeling this is going to be 6, 7 up here. Shot. Right around there. Shot. Let's go with AP. All right, we're going to take a few minutes just to get the right levels. Bear with us. If you have questions, type them up. In the meantime, let's show our audience the 30 different causes of back pain. Go north a little bit. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. All right, we're just placing our second needle on the right side at T6-7, and if you have questions, feel free to ask. Sean? 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 AP? Once I have the second needle in place, we're going to start the laser disc repair. You can see the first needle is in place. Let's verify level. Let's go up. Just double check, triple check. We're going to do top to bottom, bottom to top. So we got, let's go a little bit more. That's T1, 2, 3, 4, 5, 6, 7. I have 6, 7. Yeah, let's count from the bottom up. All right, 12, 11, 10, 9, 8, 7. Let's go further. Okay, let's go further down. I think there's another rib down there. Shot? There is. All right, 12, 11, 10, 9, 8, 7, 6. So 6, 7 from the bottom up. We got 6, 7 from the top down, 6, 7 from the bottom up. We verified we are in the proper location. We just need to finish placing the second needle, and then we're going to do a discogram. We'll put our patient to sleep. We'll do his laser on both sides. You guys can ask questions, so start typing your questions up. In the meantime, I think we're off on orbit again, way off on orbit. Maybe he moved, maybe the orbit moved a little more. Shot. Let's see, a little more. Let's see what we're doing here. Shot. I think that's better, right? That looks pretty damn good, right? Yeah, so. Hang in there, we're almost done, Shot. Are you comfortable? You comfy? Shot. He's got a really big herniation here. Shot. All right, is he going to be responding soon?
How you doing, my friend? You okay? Okay, don't move now. Don't move. We're going to ask you a question. Don't move.
All right.
You're doing great.
Folks, you're watching history right here in medicine, history of medicine. First in the world to do this type of surgery. We did it about 7 years ago, our first case. And these are patients with a unique problem. They don't have neck pain, they don't have back pain, they have thoracic pain. And he has debilitating pain right here, right where the X is. And that is due to a thoracic disc herniation. There's no surgeon in the world that does this surgery besides us here at Duke Spine Institute. I pioneered this. I'm the first in the world to do it. It's the only place you can get your thoracic disc pain fixed. How are you doing, buddy?
You okay, my friend?
How you feeling?
You all right? Mm-hmm. He says he's okay.
Are you having any pain?
You having any pain right now? Yes or no?
No, no pain. We're going to put you to sleep in a minute, but before I do that, I want to just... Well, we haven't done the discogram. How bad is that on a scale of 1 to 10?
What number did you say?
How high does that go? How much pain?
6.
Is that where you get your back pain? Is that where it is? What's the highest the pain went? Huh?
What was the number again? 7.
What's the highest it goes? What's the highest it's peaking to?
8.
All right, 8 concordant, 8 concordant. So folks, there you have it, 8 out of 10. And by the way, he took his pain meds this morning before surgery, which is why he's not having so much pain. So 8 out of 10, concordant, that's exactly where his pain is. My friend, when you wake up, that pain will be gone. Congratulations, we found it. All right, so what we're going to do is go transforaminal. I'm going to make a 4 millimeter incision. We're going to go in and get out as much herniation as we can, but more importantly, we're going to debride the annular tear. Let's show the audience how it is that thoracic disc herniations can be so painful. What's the mechanism by which they cause pain? Shot?
Disc injuries start with an annular tear, damaged nucleus. Pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
All right, welcome back. Shot. You can see from our video that pain comes from a tear in the back of the disc called the posterior annular tear that has herniation stuck in it, causing inflammation. That's where the pain comes from. We're going to fix this gentleman's disc with a single 4mm incision on the left side and another incision on the right. Hold on. So we've got just about 3 drops of blood, and I've got to place this. Let me have the cannula. Yeah, the impactor tube. Uh-huh. Uh-huh. Shot. Shot. Yes. Take it. Out. We're inside the disc. We're going to go in now and use a small tube, 4mm wide, to basically get in and remove the herniation and clean the tear. I really made the skin incision as small as possible. It's truly 4mm. Any questions?
At this moment, no current
Shot?
questions.
Shot? All right, we'll make the skin incision a little bit bigger. Shot. All right, tube is advancing down. I want it just behind the disc. Then we're going to enter through the tear in the back of the disc. Almost there now. This is called transforaminal. We're going through the foramen. Shot. We're right there at the back of the disc. We're inside the disc, right where the herniation is. We're going to now take the dilator out. We're going to be left with a 4mm tube. We're going to bring the endoscope and laser in. We'll probably see the needle from the other side while we're in there. Any questions?
At this moment, no current questions.
Let's show the audience how we use the scope and laser to repair an annular tear and take out as much of the herniation as we can.
Of course.
Disc injuries are a common cause of chronic thoracic back pain. The inflamed annular tear causes thoracic back pain. A 1/4-inch size skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK 349-6922.
Perfect. All right, welcome back. We are looking at the herniation right here. We're inside the disc at T6-T7. All these little pieces are pieces of herniation. Now, when I placed the dilator in, I pushed some of the herniation out of the foramen and back into the disc. We're going to get as much of this as we can out. Sometimes we get patients with really big disc. We can use the bigger scope, but with this patient's T6-T7, I don't want to take a chance with a bigger scope. There we go. All right, any questions?
We did get a spike in viewership, but at this moment, no current questions.
So for those of you who just joined us, we're performing live spine surgery on a patient who traveled to Duke Spine Institute. We are located in Florida. You got to fly into Orlando or Melbourne. And our institute is here in Central Florida, about an hour from Disney, Universal Studios, all the attractions that Florida is famous for. And we have people who fly in from all over the world for these laser surgeries we're doing. We've been doing laser surgery for 20 years. We've had 0 surgical complications in 20 years. Not a single surgical complication. This patient came to us from Louisiana. He's here with his lovely wife. He's had pain in his thoracic right where we're operating for the last, well, it's gotten really bad for the last year, but he's had it for longer. And there's nobody where he lives that can help him, that cure the pain. So we found out about the Duke laser disc repair, this procedure we're doing right now, endoscopic disc repair, and he came to Duke Spine Institute hoping to have some relief of his discogenic lower back pain, or sorry, thoracic pain. When we took the MRI, we saw there was a gigantic tear in the back of his disc. We're looking at that tear right now. And all this stuff I'm zapping away is what's called herniation, herniated disc, okay? So basically, he had a traumatic injury to his thoracic spine, and during that traumatic event, he tore this wall called the annulus. Annulus in Latin means ring, and he tore the annulus fibrosis wide open and then pushed out some fragments of nuclear material. We call those herniations. Now he's had the disc seal procedure. And obviously here he is having surgery. So the disc seal did not work for this thoracic herniation. And he's here to get the Duke laser disc repair, which actually does work. All right, any questions?
At this moment, no current questions.
Let's show the audience how the Duke laser disc repair works.
Of course.
Disc injuries are a common cause of chronic thoracic back pain. The inflamed annular tear causes thoracic back pain. A 1/4-inch size skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
Just want to say welcome back, but check it out. You guys can see the needle. It's right there below the laser. Right, hiding right there. Go ahead and push it in a little bit. There you go. You guys see the needle on the other side moving around?
Yes, we do.
All right, so we're doing both sides. This is the right side needle. Currently, we're operating on the left side, but we're going to keep cleaning this tear, but that other needle is sitting in the middle of the disc. That's why we're able to see it. let's take the questions from the audience while I'm working. I'm removing herniation, by the way. This is the herniation. It's stuck inside the tear, and I'm using the laser, the most precise tool in the world, to remove it. Now, some of you may be wondering, why do you have to use the laser? That piece of laser right there is 1/2 of a millimeter. You guys know what a millimeter is, 1 millimeter. And millimeter is so small, it's the space between your fingers, that if you make your fingers space as small as you can make it so you can barely see light between your fingertips, that's what a millimeter is. Millimeter is tiny. Go get a measuring stick or a ruler and look at it, and you'll see how small a millimeter is. And that glass fiber you're looking at is 1/2 of a millimeter, 0.5 millimeter. So it's extremely small, extremely precise. This is all herniation right here that I'm removing. Okay? I'll take the question from the audience.
This first question is coming from Dom, D-O-M,
Hi, Dom. Welcome.
on YouTube, saying, "Hi, Dr. Duke.
Hi, Dom.
I have facet joint problems at C2334 at
Yeah.
left side, wood osteophytes.
Yes.
Does your procedure work permanently?"
Yes. Yes, it does. Dom, you have facet joint problems in the cervical spine. My Duke plasma rhizotomy can cure that facet problem for you with one procedure. It'll take me about 20 minutes to do, and the pain will be gone permanently. Now, I'm assuming you're correct in your diagnosis. I haven't verified that. But if you want to know, you need to do an MRI review with me. It's free. We don't even charge. You can do it from the comfort of your own home. Our MRI review is free to anybody who wants it. It is not exclusive to any one person. Anybody that wants to know what's wrong with their back or neck gets a free MRI review. All you got to do is send us your MRI images. You upload them on our website, dukespine.com. Henry will put the link right there for the page. Once I get your MRI images, we'll set up a Zoom call. I will examine you, and I will tell you exactly what's wrong. If it is your facet joints, I will confirm that, and I'll tell you which ones it is and what we can do to fix it. Now, that said, Dom and anybody else, the Zoom call again is free, okay? But Henry is going to show you guys a video real quick of cervical facet joint pain, what causes it, and more importantly, how we cure it. Meanwhile, I'm going to keep working on this piece of herniation right here that's stuck in the tear, keeping it from sealing.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349 6963.
Welcome back. You can see from our video how a disc injury like an annular tear or herniation can cause so much symptoms, but also how we fix it with the laser. We're just about done with this disc, left T6-7. We're going to move on to right T6-7 in just a moment. Remember, he had both sides treated because his symptoms are on both sides. He had pain radiating from his back at T6-7, thoracic 6-7, and it radiated around the ribs on both sides, and it was causing him horrible pain. It was just getting worse and worse. Nobody could fix it for him, so he came to Florida from Louisiana for the Duke laser disc repair. Thank God he found us. He found us on YouTube, like most patients find us, and watched our videos and decided this is the only thing for him to fix his back that's available, and he's right. This is the best. So he came to Duke Spine for the treatment. All right, any questions?
Yes, we have a few more questions. This next one is a very long question and or seeking advice coming from Pure Honest, Very Caring on Facebook,
All right, sure.
saying, why when I see an orthopedic spine surgeon, as he reads my MRIs and says I need L45 5S1, discectomy, minimally invasive endoscopic, laminectomy C5-6, discectomy, minimally invasive endoscopic, but at the end of the consultation, he told me he doesn't do endoscopic. He only puts screws, rods, and plates. So I asked him, can you recommend someone that does endoscopic? He refused to. He kept suggesting to me. He has a list of pain management doctors that I should try and try out all these new techniques. I told him I don't need that. That's all temporary. Why do surgeons sometimes only recommend different pain management and not suggest you how to resolve and fix your injury?
That's a great question. The answer is very simple. Fixing back pain and neck pain is not a surgical fix. There is no surgery in the world that fixes back and neck pain. I'm the one who discovered the surgery that fixes back and neck pain, and you're watching it right now. The problem is every other surgeon believes they don't do back and neck surgery for back pain and neck pain. They do it for pinched nerves, which cause weakness in your arms, numbness in your arms, tingling in your arms. In other words, spine surgeons are not trained to do surgery for back and neck pain. They're trained to send patients to pain management doctors, who then do shots, stimulators, and other treatments for pain. In other words, back and neck pain is not treated by surgeons. It's treated by pain management doctors in the world. That is what I was taught, and I rejected it. I decided I was going to find a cure to back and neck pain, that it was a cure to the patient, and it turns out the only way to cure back and neck pain is with surgery. The problem is these other surgeons don't know that. They believe if a patient has back and neck pain, they have to send them to pain management. That's what I was taught, to send patients to pain management. And it turns out pain management can't cure their pain, but surgery can. But the surgeries that cure back and neck pain, I had to create them. I had to create them out of thin air. And that's what I did. So I started doing fusions, and I was curing people's back and neck pain with fusion. But you have to fuse the right discs, and most surgeons don't know how to figure that out. So it's called making the right diagnosis. Most surgeons cannot make the right diagnosis. If you make the right diagnosis, then you can cure back and neck pain with fusion. The problem is you don't want to do fusion, because fusion is very bad, very dangerous, very invasive, and really destroys the inside of your body during the surgery. We're doing a whole blog series on spinal fusion for the lower back and why it's so bad. Just check out our website, go to our blogs, and you're going to see a blog a day being produced at Duke Spine explaining why fusion surgery is so bad for you. You're not going to hear that from the surgeons doing fusions. They want you to believe fusion is the only treatment, no matter how bad it is, you still need it. but it's not true, you don't. Again, Duke Spine, I created these treatments. These are all novel treatments created by me, the founder and pioneer at Duke Spine, Dr. Duke Majan, and we're the only ones in the world doing these treatments currently. They are the standard of care. They're all FDA approved. I only use FDA approved equipment, supplies, so they're FDA compliant. Everything we do, safe and effective, and they've all been peer reviewed and published multiple times. So all I can tell you is most surgeons believe back and neck pain is not something that's fixable with surgery. That's 99% of surgeons believe that. A few of them know that back and neck pain can be cured with surgery, but you have to do the right surgery. So that's why spine surgeons tell you to go to pain management, because that is the standard answer. All right, we're done with this disc. We're now at the end of the disc. You can see there's the epidural space. That's the tear right there. We cleaned it completely. It looks beautiful. How come I don't have laser? What? All right, so we're pretty much done with the left side. I'm going to move on to the right side.
Lights on, please.
Lights on. Any questions?
Yes, we have a question coming from Dom once more on YouTube,
Yes, Tom.
asking, does this procedure work permanently? Thank you, Dr. Duke. I love the way you talk blue-collar language.
Yeah. Our procedures at Duke Spine are permanent. They are not permanent anywhere else you go. Anywhere else you go, it's not permanent. Duke Spine is permanent. We do it different. We do our rhizotomy differently. Okay? Very important to understand. How's blood pressure? All right. We're done with the left side. We're going to move on to the right side. Watch that. I'm just going to apply pressure. Look how small the incision is. It's a 4 millimeter incision. There's no need for a hospital for this surgery. It's outpatient. He's going home in about an hour after his surgery. I'm going to come over to the other side in a moment and go ahead and do the other side. You guys switching the laser out?
Yeah.
All right. Any other questions?
At this moment, no current questions.
All right, we're going to go to the other side, the right side at T6-T7. Remember, this is thoracic. Very few thoracic disc problems, thank God. About 5% of symptomatic disc herniations are thoracic, probably less than 5, maybe around 2 or 3%. The vast majority of back pain or disc problems are lower back. They cause lower back pain. About 3/4 or 75% of all painful disc injuries cause lower back pain. They're in the lower back, lumbar. About 1/4 are in the neck, and about 2% to 3% are thoracic. This patient has thoracic. We've done about 30 of the thoracic Duke laser disc repair patients in the last 7 years. And our success rate of curing pain in this spine is 99%. We looked at our patients 1 year after surgery, 99% of the pain was gone. That was the average. Mostly hundreds, and maybe 190%. But there was like almost all of them were 100% shot. All right, so we're going to go ahead and take this next needle out, leaving the guide wire. Guide wires are something that was taught to me as a neurosurgery resident back in the 90s. We were doing guide wire surgery in the spine, and orthopedics do it as well for joints. But I did not pioneer guide wire surgery. I did not pioneer dilator surgery. This is all developed by doctors much smarter than me. But the system that I use uses guide wires, dilators, and endoscopic tubular dilators. Sorry, not dilators, but retractors. All right. We're entering the disc. Okay, good. Take it out. Perfect. Any other questions?
At this moment, no current questions.
All right, so tube goes in. For those of you who've never seen the surgery, the entire surgery is done minimally invasive. I laugh at other surgeons who say they do minimally invasive surgery because they do not use this minimally invasive system. Their idea of minimally invasive is about an inch. Ours is 4 millimeters. So just so you understand, this is the most minimally invasive spine surgery you can do. There is nothing less invasive than this. So we actually do this through the smallest tubes possible. Everything that everybody else does is bigger. But they love saying minimally invasive to you because it sounds good and it sells. But true minimally invasive surgery is what we do at Duke Spine. Other doctors don't do it. All right, here we go. Down to the disc. We're a little off on our orbit by about 4 millimeters. 4 degrees, I mean. Shot. It's still off a little bit, but it's better. All right. All right, so now we're advancing the dilator. We don't want to go any further. Any questions?
At this moment, no current questions.
All right, we're just about finished with the surgery. I've got to clean this disc up and we'll be done. It's perfect, yeah. You guys see the end of that tube?
Yes, we do.
Inside the tear in the back of the disc. That's where we're going to put the scope and the laser. It's going to go down to that opening. How's the laser? Switched. Do we know what was wrong? Low energy. Give it a Red Bull. Maybe it needs some flying burrow. Right? Get its energy back. What do you think, Dr. Burndes? My wife is so funny. She eats dinner and then 10 minutes later she goes, oh, now I have so much energy. I'm like, it takes 6 hours for the food to get through your digestive system. How could you possibly have more energy? She's like, I don't know, I feel like I have more energy. I'm like, well, you don't. Okay? Not yet. Your food is not digested. It's not absorbed. Biochemically, you do not have more energy yet. All right, any questions?
At this moment, no current questions.
Great. So what should we show the audience, Henry?
That is a great question because we have shown them pretty much a vast of all of our animations with
We
thoracic
showed them everything.
and lumbar, yeah. I mean, going back to what Pure Honest Very Caring was talking about all those invasive procedures that they were recommended.
Yeah.
You know, I mean,
Why don't we show them the difference between, say, the Duke laser disc repair versus other types of invasive surgeries?
Of course.
I think that's a great thing. Hi, I'm Dr. Duke Machen. We've just completed our free MRI review at Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke Laser Disc Repair. We've been performing the Duke Laser Disc Repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke Laser Disc Repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke Laser Disc Repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. And welcome back. You can see from our video, there's lots of treatments out there that doctors are recommending because they're quite profitable for the doctors. Unfortunately, they don't work for the patients. But the Duke Spine Institute has the treatments that do work to cure back and neck pain. We're the first in the world to offer cures for back and neck pain. The very first. We've been doing it for 20 years. And our treatments are unique and they target the source of pain. How do we know where your pain's coming from? Well, that's the Duke Spine exam. Duke Spine exam. It's an examination I do with you over Zoom. We do it in person as well, but we prefer to do it by Zoom. It's more efficient that way for everybody. You don't have to travel to Florida just to get an examination. You can actually get it done from the comfort of your own home. The Duke Spine exam. Anybody else in the conference room with you?
No, not the moment.
All right. I do want to say happy Rosh Hashanah to my Israeli Jewish friends out there. It is a, huh? It's Scrub Tech Week. Who knew? Well,
Yesterday, National Wife Day.
National Wife Day was yesterday? Sunday? All right, we got a lot of national days.
No, never. That'll never happen.
Just an International Wife Day? All right. Why, do you have a husband, Hector? Well, you mentioned it. I don't know. Just about finished here. We've already finished the patient's left side. We're currently working on the right side at T6-T7. A lot of pieces of herniation coming out. And as I've said to many people before, we are not trying to remove 100%. We would never will. If my goal was get rid of 100% of the herniation, and we had to do that every time to get rid of the patient's symptoms, I wouldn't even do surgery. I would just retire because it's impossible to get 100% of every herniation out. As a matter of fact, it's 100% of a herniation removed is impossible. It's just, I've never heard of anybody doing it. The patient would have to be dead, maybe in a cadaver lab. Even then it would be impossible, you know. But what we want to do is we want to get about 50% or more, and that gives us a great result. I know we have some questions. Type them up. I'm going to come answer them for you face to face. This is the last bit of herniation right here. I have about a minute left and we're done. So type up your questions. We're going to show you a quick testimonial while I make my way over there. And then we've got the next patient is going to be bilateral SI joint DPR. He's actually, he may be a local. I'm not so sure about that. He's going to be in Italy. I need a grabber. I think he may be an Italian. Italiano Staliano, maybe. All right. Type up your questions. I'm going to answer them for you when I get there. In the meantime, just putting the final touches on this herniation. Flip it. Watch the fiber on my face. All right. How many questions do we have?
As of right now, just one.
All right. Last Chance Saloon, type up those questions. I told my staff I've been watching a program called Stranger Things. There's some epidural fat right there. One last grab and we should be done. They're getting ready to release the season 5 final season, Stranger Things. We're done.
Sit down, please. Thank
I'm going to come answer your questions.
you. Scope up.
Okay? You can see lots of little pieces of herniation here all along the skin. They'd all floated out from the tube. The laser released them. They're scarred in there into the tear. Laser released it. Then they float out with the irrigation. Wonderful surgery, minimally invasive. 99% average pain relief with this surgery. We'll find out tomorrow how he's doing, our patient from Louisiana. All right, let me show you this incision, and then we're going to end the stream, and we'll be back for a bilateral SI joint. Look how tiny this thing is. No bleeding, no hospitalization, outpatient, most advanced minimally invasive surgery in the world. 4-millimeter incision. Beautiful. Look at that. Gorgeous, huh? All right, let's go to a testimonial, and then I'll come answer your questions. Type them up. Good morning, I'm Dr. Dumajan. It's February 12th, 2025. I'm sitting here with one of my patients who underwent the thoracic Duke laser disc repair for a herniated disc in his thoracic spine. You came to us with horrific pain in your spine, and you came from Georgia. You had your surgery done 12 hours ago, and here you are after surgery. How do you feel?
I feel great. No more tired legs, no more hurting ribs. I don't know how to feel right now. I've had a hurting back for 2 years, been very depressed, felt hopelessness.
And why did you feel hopeless? Because the other doctors couldn't help you?
Well, I didn't want to go the route they wanted to do. I didn't want no fusions or nothing like that. I was on the verge of giving up. I didn't basically want to live no more. And I told myself that I can't do this no more. And I did. I got online, just happened one day, type in back surgery on YouTube, and I seen Duke spine. So I started looking and watching, and I was like, I'm going this route. I'm glad I did.
You can actually see we did your surgery yesterday in the thoracic. It was not easy to get into the disc, but we eventually did. Fixed your T8-9 herniation. You could see the laser in there cleaning up the pieces of herniation that were causing all that pain. Now here you are. When did you realize the pain was gone?
Immediately after I woke up from surgery.
Yes. Right? And look at you, you're smiling.
It was awesome. I mean, getting up this morning wasn't like it usually is. I got straight up, and the other times I basically had to crawl out of bed. Been a long road. My body don't know how to act right now.
Well, you got a lot of good living ahead of you now that your back's fixed. Anything you want to say to the rest of the world?
If you're having back problems and don't know which way to turn, I advise you to do your research, find Duke spine. Dr. Duke will fix your back. I guarantee it.
Thank you so much, sir. Safe travels home.
Thank you.
All right. Hey, good morning, March 6, 2024. I'm Dr. Dumajan. I'm here at Duke Spine Institute with one of my patients who traveled here for a thoracic disc problem. I'm going to let her tell you a little bit more about how life was before her surgery. Thoracic disc herniations and pain, they're not as common as lumbar and cervical, but when they do happen, they can rob people of their quality of life. What was your life like before you had your surgery yesterday?
Oh, miserable. I spent over 5 years being in 24-hour pain. Just pain. Couldn't go anywhere. 95% of my time is at home, in the house. Before then, I would dance, have fun, work out. But now, pretty much, I'm a prisoner in my own house, in my own body.
And where was your pain?
Right at T3, T4, burning, aching, 24 hours a day, no sleep, nothing. Just sitting in the house all day, not living my life at all.
And yesterday we went in endoscopically. We found that T3-4. We used the laser to clean out your disc and get rid of the herniation and the tear. How do you feel today?
Oh, I feel fantastic. I feel like a new person. I feel like I got a new beginning, a new chance at life. Thank God for you.
You know, the burning, it's common for people to have muscle pain after the surgery. We can't fix muscle pain. We fix joint pain, but we can't fix muscle. And unfortunately, when you have joint pain like you did, the disc pain, it's a deep knife aching pain, and it keeps you from doing things like you said. You were robbed of dancing and doing all the activities you normally do. So the muscles get deconditioned. They start to get weak. It takes time to rebuild them. And that's one of the things we can't do as surgeons. We can't rebuild your muscles. The patients have to. And so now you're going to go out and be active.
Absolutely.
You're going to start dancing again.
Absolutely.
And who are you going to think about when you're dancing?
You?
Dr. Duke and Duke Spine.
I'm gonna make up a Duke line dance. How about that?
Oh, I love it. Promise me you're going to post that on YouTube so we can see it.
I have a YouTube channel. You gotta come to my YouTube channel.
I would be happy to come on your YouTube channel.
Sure.
You have my cell phone number. Text me. Let me know what you want me to do. I would
Okay.
love to
Okay.
do whatever you need me to do on your
Absolutely.
YouTube channel. It would
Absolutely.
be an honor.
And I want to say one other thing.
Yes, ma'am.
If you're in pain, don't ever give up. Our research countless
Amen.
nights. Countless nights. Don't believe what the first doctor say. I had doctors to tell me just be this way the rest of your life. I refused to give up.
Mm-mm.
I said, no, you're just practicing medicine. I'm moving to somebody else. So don't give up. Don't believe the first doctor, the second, third, fourth, or fifth. I've seen over 20 doctors to be exact. So don't give up. Do your research and come to this man, Duke Spine Institute in Melbourne, Florida. Don't give up.
We've been very blessed here at Duke Spine for several reasons. God has given us the ability to understand where pain comes from, but also how to get rid of it
Absolutely.
properly and safely.
Absolutely.
And that's what we did yesterday. We went in with the endoscope and we found the tear and we used the laser. We did it all with a 4mm incision. You can almost not see it on her back. I had to look for it.
Right.
But it was right next to that giant incision that
Yes.
they did. Some doctor tried to cut her muscle out of her spine
Yeah,
to
he
get
did
rid of her
trigger
pain.
point excision is what they call it. Yeah.
That was a first for me in 26 years of practicing spine surgery. I've never seen that. Cut the muscle out. But that's not the right thing, folks. Muscles are not the main source of pain. It is the joints, and the muscles are secondary. So fix the joint problem underneath, and the muscle pain will eventually go away. Congratulations. Is there anything else you want to say to your people out there, your YouTubers, your followers?
Absolutely. Just stay tuned. The party is going to happen. The party is going to happen. And one other thing, you said this was the first time you ever seen this. You're the first doctor I ever seen do what you do.
Thank you.
So we're 1 and 1.
There we go.
Hey. Thank you so much, Dr.
You're
Duke.
welcome. Safe travels,
Thank you.
sweetheart. I'm Dr. Duke Majan. I'm sitting with one of my patients who had life-changing surgery yesterday. She's crying because she has, I believe, tears of joy, and she wants to share her story with you. How long have you had thoracic spine pain for?
Over a year now.
How did it happen?
I got into a decent motor vehicle accident on September 12th of 2022
And that was in California where you live.
in California.
And you've been in pain since then.
Since then,
What did the doctors in California do for you?
I've seen 4 different neurosurgeons. All 4 had a different opinion of wanting to do surgery. I was too young for surgery, and majority vote was to seek out pain management for the rest of my life.
Pain management for the rest of your life. And how did that make you feel?
Like my life was over. I went from being gym rat, as you call it, and 4 different softball teams. I was an athlete, I was a coach, worked out 5 days a week, to not being able to do anything.
Yeah, I'm sorry. Where did that leave you in terms of options?
A lot of depression, a lot of mental. This is my new life. Deal with it. There was no help. And expect you to live on pain medicine the rest of your life.
So how did you find Duke Spine?
I had pretty much personally given up. I felt I had tried every option in California. I had no idea going out of state was even an option. Thanks to my husband, he is the one that dug and said, I'm not quitting. There's got to be another option. There's got to be another person. There's got to be another opinion. He searched and found a old YouTube video of someone with the same T7 injury that I had. And he said, we're going here.
To Duke Spine Institute.
Yes.
And you did. We did our MRI review with you and we identified several discs in your thoracic spine that were probably causing pain. And when you got here on Monday, we did a special x-ray, didn't we?
Yes.
To help localize which of those discs were causing the most pain.
Yes.
And we figured out it was 2 of them that were really bad, causing most of your symptoms. And you had your surgery just yesterday. didn't you? You
I
can
did.
see in the surgery we made 2 little 7mm 1/4-inch incisions. We went in with the scope and the laser and we cleaned out the herniations that were causing all of that pain that you've been suffering with. How do you feel today?
Like a whole different person. I got out of surgery yesterday and just cried.
Cried because the pain was gone.
It was gone.
Yeah. And that's a pretty big deal, isn't it?
Like you wouldn't believe.
Oh, I understand. That's why I chose to do what I do, to end people's suffering. Where other doctors fail, we can help people. So the pain you had that was unbearable is now gone.
It's gone.
And is your husband happy about that?
It was very emotional last night. And he said, "Are you crying because you're hurting?" And I said, "No, I'm crying because I'm not in pain anymore."
It's impressive. So if you had to do it all over again at Duke Spine, would you?
1000%. I don't regret a day of it, any of it.
Well, I'm hoping someday this technology will spread and other doctors will be able to do this procedure to help people with thoracic disc pain. You had those herniations just ruining your life, and now you have a new life to look forward to. What are you looking forward to the most?
Being the parent I once was with my 3 kids.
Yeah.
Going to the gym again, not waking up in excruciating pain, and just living a normal life that I once had.
Did you talk to your kids?
Not yet.
You haven't?
No.
Okay. Well, and by the way, we don't have you on any medication, so you're not on pain meds, are you?
No.
We didn't give you powerful narcotics to kill your pain. You had propofol sedation. For those of you who don't know what propofol is, it's not a painkiller. It just makes you sleep. So when you wake up, whatever pain you have, you have. There's no pain meds used at Duke Spine after surgery. We want our patients, we want them to experience what life is like without pain medication and no pain.
We accomplished that.
Anything else you want to tell your fans out there or family?
If you're in pain, this is the place to go.
When do you travel back home?
Today at 5 o'clock.
All right, so we got to get you out of here.
Yeah.
All right, congratulations.
Thank you.
I'm happy for you.
Thank you.
Good morning, I'm Dr. Ara Duke-Majan, CEO and founder of the Duke Spine Institute. I'm here with one of my patients who's traveled as far from Austin, Texas. He came to Florida to Duke Spine Institute because he had a problem with his thoracic spine. He's had pain in his thoracic spine, and I'm going to let him tell you a little bit more about it. But I can tell you one thing, he just had surgery yesterday, the Duke laser disc repair. How are you feeling today?
I feel amazing. The relief is incredible. It's more than I imagined.
And you were saying outside you were on the verge of crying, or you were crying yesterday because of the pain relief. I'm here to answer your questions. Dr. Duke-Majan, Duke Spine Institute. Thanks for joining us. This was a thoracic herniated disc that was causing horrible pain right between the shoulder blades, radiating around the ribs. Not a common problem, thank God. But we have the solution now at Duke Spine, a safe procedure that's extremely effective, basically 99% pain relief 1 year after the surgery. I mean, you feel it immediately after the surgery, but even a year later, it's durable. So the big thing with medicine is, all right, you got a treatment. Is it going to work? And is it going to last? Is it going to work? Is it going to last? And what does it cost me? I don't mean money. I mean, what does it cost me? Like, what if I get pneumonia, right? What if my kidney dies? Then I lost a kidney, right? What if my leg has to get amputated afterwards? That's what it costs me. That's the real cost of surgery or treatment, is complications, long-term negative effects, collateral damage to your body during the treatment. So that's what you all need to be reprogrammed to think about, because doctors don't tell you about the bad stuff that happens. You read about it on the internet, but by then it's too late. So it's better that we tell you at Duke Spine, go to our website, go through all the pages, we'll tell you all the bad things about every treatment. So with the Duke laser disc repair, it is the most effective treatment in the world, 99% pain relief. With the durability, it lasts a lifetime. It doesn't come back. With the safety, we've had 0 surgical complications in 20 years. 0. There is no other surgery or treatment in the world that has zero complications. That's how safe it is. Of course, I'm a good surgeon. It's a testament to my ability and my practice. But that said, safe, effective, durable. And what will it cost you? Nothing more than what you pay for the surgery. That's wonderful news, isn't it? All right, what questions do we have, Henry?
These next two questions are both coming from Dom on
Hi, Dom.
YouTube.
Welcome.
First question asking, Dr. Duke, have you heard of Tony Mork?
Yeah, of course, I know Dr. Mork. I have his phone number on my cell phone.
He goes in with his scope and severus nerves and osteophytes. Does your procedure work better?
Yes, my procedure works far better. We tried the endoscopic rhizotomy. It was taught to both Dr. Mork and myself at the same exact time by Dr. Anthony Young, who is the Yoda. If you love Star Wars is my favorite movie in the world. It still is. Best movie ever made. Star Wars, the first Star Wars. 1, 2, 3, right? Star Wars, Return of the Jedi, Empire Strikes Back. Sorry, Empire Strikes Back and Return of the Jedi.
Yeah.
Right? Those three are the best. And in those, you'll meet Yoda. If you don't know who I'm talking about, go watch Star Wars. The Yoda of endoscopic spine surgery is Dr. Anthony Young. It's not me, it's Dr. Anthony Young. I'm more like the Obi-Wan Kenobi of endoscopic spine surgery. Dr. Mork is he's a Padawan still, all right? But I trained with him with Dr. Young. I'm just having some fun. And Dr. Young calls himself Yoda, and he is Yoda, by the way. He's now in his 80s. He's retired. I think he still develops stuff. His son, Chris Young, is still working in Phoenix doing some endoscopic, but also open. Long story short, Dr. Mork learned endoscopic rhizotomy from Dr. Young. I learned it from Dr. Young. We tried it for a while. It sucks. It doesn't work. You can't see anything. It's so much blood and muscle. You're supposed to find the nerve. You can't. I tried. It sucks. The Duke plasma rhizotomy is 1,000 times better. It works better. It's faster. We were doing like 30 minutes to find one nerve. It was ridiculous. You remember those days? We actually have a few endoscopic rhizotomies on our YouTube channel. You'll see. Go watch it. It sucks. You can't see anything. It's like being in a blizzard. But with the Duke plasma rhizotomy, we use X-ray guidance instead. It's amazing. It works every single time. All right, next question.
Next question from Dom once more on YouTube asking, Dr. Duke, do you use the scope on the facet joints in the cervical spine?
So the question is, do I do endoscopic rhizotomy in the cervical spine? No, I don't do any endoscopic rhizotomies, period. I stopped doing them because, again, you can't see anything. It's a lie. It's basically a marketing tool. It doesn't work. The Duke plasma rhizotomy works.
And that is it for questions.
All right, we'll be back shortly with a bilateral SI joint DPR. And that's a patient with sacroiliac joint pain, chronic, debilitating, right around his tailbone on both sides. And he wants to have this procedure done. It'll take us about 30 minutes to do it.